My name is Victor Iannello, and I live in Roanoke County. In 1993, I started a company called Synchrony, which I ultimately sold, specializing in industrial technology for the energy and defense sectors. I have recently started Radiant Physics, a product development consulting company, and Radiant Ventures, which invests in early-stage companies in our region. I am deeply involved in Roanoke's business community. I serve as chairman of the Roanoke-Blacksburg Business Council, vice president of the Roanoke Regional Partnership, chairman of the Business Leadership Fund, chairman of the Carillion Medical Center, and a director of Carillion Clinic. I include information about my activities and associations to demonstrate that my philosophical leanings are for capitalism, free markets, economic independence, and smaller government. Virginia rightfully takes pride in being a well-managed state that does not blindly participate in every federal program that comes our way. Virginia has, thanks to the efforts of the General Assembly, implemented programs in a business-like manner when other states often have not. It's this common sense approach to governance that attracts and retains pro-business citizens like me. Today I'm here to talk about ways to close the coverage gap for uninsured Virginians. The consequences of not expanding coverage are significant. Carillion estimates that it already had to absorb almost $19 million in reimbursement reductions since 2010, and over $31 million in ACA and other cuts will have to be absorbed in 2015 if Virginia fails to find a solution to the coverage gap. The shortfall of $31 million is 1.5 times last year's operating income. It's this operating income that funds capital improvements, expansion, construction, renovation, recruitment of physicians, and many other things that make it possible for Carillion to be one of the top health systems in the nation. As a director of the clinic, these projected losses have me very concerned. As a business leader that has worked hard to promote economic development and growth in our region, I assure you that much of the region's ability to attract and retain businesses is related to the quality, accessibility, and cost of healthcare in the region. Simply put, a company is not likely to locate to a community without a local hospital that can provide excellent care for its employees and families. Indeed, the financial health of a community's hospitals has a direct impact on the financial health of the community. However, we are on a dangerous path that threatens the financial stability of hospitals in Virginia. Health systems are often the largest employer in the region. In fact, Carillion is the largest employer in the western part of the state. A shortfall of $31 million will inevitably have a negative impact on jobs. We are also in danger of putting Virginia at a competitive disadvantage relative to states that accept federal money earmarked for the Medicaid expansion. Ultimately, the health care cost for the uninsured will be borne by the privately insured, which will drive up insurance premiums in Virginia. This will increase the cost of doing business in Virginia and will make it harder to attract and retain businesses. I'm encouraged by the legislation recently passed by the state senate called Marketplace Virginia. It seems to be an excellent compromise that closes the coverage gap without expanding the Medicaid program. Under this plan, Virginia would receive $1.7 billion that is currently earmarked for Medicaid expansion. The money is in turn used to subsidize the purchase of private health insurance plans for those currently falling in the coverage gap. If, in the future, the federal government reduces or eliminates its obligations to fund the program, Virginia retains the right to terminate the program without future financial liability. The marketplace is appealing to me because the administration of the plan is left to private insurers. Most of the business community is in favor of accepting federal funds to reduce the coverage gap because it allows Virginia to better compete. On behalf of the business community, I ask that the General Assembly find a way to put aside partisan politics and reach a compromise that will improve the accessibility and cost of health care in Virginia while reducing waste and fraud through innovation and reform. Thank you very much.
Chairman, members of the committee. As indicated, my name is Shep Miller. I'm actually from Norfolk. Worked in Newport News many years. Now in Virginia Beach working, so I'm really a Ambrose guy. I'm here just to address this coverage gap as well. I'm the owner of a number of businesses in Hampton Roads, including a defense contracting firm with fiber optics business that works across our country. It's nice to be back. Some of y'all were here Chambers, executive board, and a number of other things. Like many people, I'm frustrated about where we are in healthcare in America. I'm not a fan of the Affordable Care Act. In fact, I sort of joke about it as the Unaffordable Care Act. I think it was well intentioned. Covering people is important. I understand that. I just don't think it's the right vehicle. No matter what, that's what we are. We're there, it is the law of the land. Justice Roberts made his ruling, and it is what it is. And it affected my company fairly significantly. We changed our healthcare plans. We don't fund like we used to. We were a very generous benefit company. I used to fund 70% of whatever health insurance you took, so if your whole family was on my plan, I funded 70%. That day is gone, and the reason it's gone is because of cost. The plans being proposed by this Senate Finance Committee, the Virginia Chamber of Commerce, and other businesses through the Healthy Virginia Works Coalition appear to reject the ACA and establish a Virginia model, drawing down 100% of the federal funds while ensuring all hospitals are paid for the work that they do for currently uninsured individuals. Today, we are paying mandatory federal taxes while we continue to fund indigent care. And I would just diverge for a second. I believe that no matter whether we draw those funds down or not, that the model that we have is working. When you have folks who go to the hospital, go to the emergency room for their care, which is mandated by law that we serve, and that's where they go to get non-life-threatening, chronic problems dealt with, that is a very expensive way to deal with healthcare. We're paying that one way or the other. The businesses are paying, the employers and employees are paying for insurance premiums. So regardless of whether I drew down those funds or not, I'd say change that model. Get those people in primary care where they have some preventative care. I'm assuring you that our costs will be less than it is the way we do it now. But to add to that, we're leaving a lot of money on the table, folks. And all of us in this room are paying those dollars to the federal government. It makes absolutely no sense to me, and I understand the politics of it, but it makes no sense to me to leave that kind of money that we pay to the federal government and not bring it home to reduce our costs in Virginia. I'm a believer in doing that. We're paying the new individual and consumer taxes and fees, insurer taxes and fees, employer taxes and fees, and manufacturer taxes and fees. Those taxes are designed to finance the health care for the uninsured. Washington has those dollars currently, and I want it back in Virginia. So whether it's the Marketplace Virginia plan, or whether it's the Chamber plan, and I'm not a fan of expanding Medicaid here, when either of those two plans or some sort of private option, it is unconscionable to me that we would take those dollars and figure out how to do it in a Virginia way. I believe we're in a low-risk situation here. I do understand the concept that if Washington doesn't keep paying, then they're going to be looking at you. I was with the governor today, 2-3 hours ago at Hampton Roads. He told me, I believe him, that he'd stand up and take a hit for that, tell him it's his fault, not your fault. Not that really, at the end of the day, it matters to those folks who are being impacted, but that's the reality of the situation. And I do believe that he would support the Marketplace Virginia plan. He told me he would, or the Chamber plan. He just wants a plan that gets the money back here, reduces our costs, and helps our population. Having a strong healthcare provider network in the community is critical to economic development. In my area, some of the largest employers outside the military and other federally funded operations are Centera, Riverside, and Bon Secours. Those providers not only support jobs by ensuring we have a place for the workforce to be treated, they create jobs directly and indirectly in the community. They seem to be facing real threats not to close or go away, but to avoid new hiring wars, potentially reduce employment levels based on federal cuts. And we do know that some hospitals will close that are on the edge. And a lot of those hospitals happen to be in places that are not well served with the ambulance. So as you look at economic development, and we're trying to help somebody in Tazewell, you think anybody's going to locate a place in Tazewell, you got to get an ambulance and go 45 minutes if you have a heart attack? I'm not going there. I'm not bringing employees there. It's not going to happen. So we've got a fragile situation in some of those hospitals, and if we don't close this gap somehow with them, some
Good afternoon, Co-Chairman Colgan and Stosh and other members of the Senate Finance Committee. I am Teresa Sullivan, I'm President of the University of Virginia. I'm happy that you've invited me here this afternoon. I want to say I've lived in several states and I've been impressed by the effectiveness of the General Assembly in Virginia, and particularly your ability to find the Virginia way to good governance. I was asked to speak today to Governor McAuliffe's proposed budget. This budget provides a 2% salary increase for all state employees, including university and college faculty and staff. We're grateful for that proposed salary increase. Improving compensation is critical to increase the quality of UVA and also to enhance the recruitment and retention of our workforce. As I met with both the House and Senate conferees in late February, I recognized the efforts that both bodies took to improve employee compensation beyond what was included in the introduced budget. I shared with you then that one of my biggest priorities at UVA is employee compensation. For staff, our goal is to offer salaries at the average market rate. We've made some progress there, but we have a long way to go. Our faculty workforce is aging, and we're thinking strategically about recruitment over the next several years. Of our current tenured faculty, 65% are age 55 and older, and 16% are 65 and older. At the same time, our peer institutions are mounting aggressive efforts to recruit and hire faculty talent as they face their own generational turnover. It's hard to predict with certainty which faculty will retire, but if we model it on retirement age 68, we'll have 275 faculty retirements over the next 6 to 8 years. And we also look to expand our faculty by about 140 members because of our continuing enrollment growth. We have to be competitive in the marketplace to get the most talented faculty to UVA. State support of salary increases for faculty and staff is essential because UVA receives less unrestricted general fund support per in-state student now than we did in 1990. As I think you heard from the Virginia Business Higher Education Council, we would welcome the higher level of funding for higher education among the various budgets that have been introduced. There are things we like in all the recommended budgets. We do need to know what support we can count on from the state. It guides our planning and it provides certainty for our tuition setting as well as assembling financial aid packages for our students. And ultimately, it helps us in providing affordability to students and families. These comments are so far focused on our academic division, but half of our revenues and half of our faculty are employed in our medical division. I want to spend a few minutes discussing issues around financial support for indigent care. In fiscal year 13,